Very good morning, Priscilla. Thank you so much for joining us. Tell us why you felt the need to do such research.
Thank you for having us on TV this morning. Yes, this is a very important survey because in any situation, it's critical to know what the public are thinking, what they know, to be able to understand what, how public are responding to fake news versus real fact. So, and this will also feed into national communication strategies. So that's why the HSRC launched the survey. We launched it on Friday last week. We've only had 16,000 responses thus far, and we're hoping these kind of interviews will result in more and more South Africans taking the survey. Another thing to add is this particular survey will be closed down on Tuesday night, and we will add another survey which would respond with questions directly about the lockdown and what people understand by it and how they're coping and what prevention measures they're taking.
I'm curious about the demographics that you use for your survey, and also what platforms are you using to conduct the survey?
We're using a BNow Moyo data-free platform. And yes, we're also extremely concerned about the demographics given the circumstance in the country. We are doing additional qualitative work with people from taxi drivers to medical personnel. We will be able to explain those demographics once we do the analysis, and as you can understand, the analysis is in the process. It will be the findings will be released in terms of the national response with the Department of Science and with the DSI.
And I bring the demographics up because obviously that could skew your at the end of the day, your analysis at the end of the day when it comes to analyzing your research. And also, you're also looking at the state of readiness to deal with this pandemic. And my first question there would be, I don't think anybody was ready in the world for this pandemic.
Well, let's see. It is a survey, it is research. We can only report what we find, and I'm not quite sure at this stage what people would have said about the state of readiness, but we have asked the question. And as I said, in the next survey, we'll ask more detail. It is very, very difficult because we can't do a one-to-one, one-to-one, door-to-door household survey, which we were originally planned and wanted to do. But the epidemic moved very, very quickly, so we had to pull back and respond to doing it in an ethical way that protects both the public as well as the researchers.
Okay, now as the Human Sciences Research Council, this research, once you've analyzed and everything, what will you use the results for? What will it inform?
Well, it will be able to tell us what the sentiment on the ground is. It will be able to tell us what kind of knowledge is out there. So, as I said at the beginning, we'll use it to feed into the national communication strategies and campaigns. We would definitely be able to make recommendations to government how to alter or change the campaigns.
Okay, just a quick one, Human Sciences Research Council. What's your take with what government has done so far in terms of, the president announcing the lockdown? Are you happy with the reaction so far from our government?
Yes, I think government has behaved very, very responsibly, right from the president to the entire team. I think the lockdown came, well, who's to say, but I think the lockdown came at the right time, albeit there are problems, but I'm sure, and I see them working hard, and we're all working hard to help obey, so to speak, the lockdown. I think Italy, who locked down way too late, has already lost 10,000 citizens. That kills the morale of a country. In our situation, we have lots of challenges. One of them just being the number of people that are HIV positive, that are probably not on treatment, people who have TB, and some of our horrible living situations in the informal settlements. That's going to be the real challenge on how we will handle and our preparedness to handle infection in the communities. I live in Cape Town. I understand that there are 5 people in Mitchell's Plain. There are people in Khayelitsha who have tested positive. We have to really, really act quickly, test, isolate, and to beg the South African public to follow the lockdown. And as a sportsman said yesterday, if Madiba could stay served involuntarily, do a jail sentence of 27 years, we can do 21 days.
Priscilla, just a quick one there. You used the word beg the South African public to stay indoors. You've done a lot of research. You deal a lot with the South African communities. Why using the word beg?
Because it's a very, very difficult time world over, from New York to Khayelitsha. And you know, there's some of us who are extremely fortunate to be educated and to understand the nature of this disease. As it moves, we're also a little bit confused. But it's really difficult for people to understand why they have to stay inside the house, why they have to keep away from friends and family. It's not easy. Behavior change is very, very difficult. And the president issued a very responsible but tall order. So I've seen people try to find loopholes and dodge the lockdown. And we just have to remind South Africans of what happened in the Spanish flu in 1918 and how many, over 350,000 South Africans died. And we could end up, despite the responsible lockdown and all we're doing, the more infections we get, the more serious illness we get, the bigger the burden on the healthcare system. Oh, by the way, we're also launching a survey for our healthcare personnel, which we'll probably launch online on Thursday after we get all the approvals and permissions to contact the various professional organizations as well.
All right, thank you so much. Well said, Priscilla Reddy there from the Human Science Research Council.